1632, 174, ABCD, all this and more on Health and Retirement.
Are you approaching your golden years? On this show, we're talking all things health, from the doctor's office to the gym and back at home. Welcome to Health in Retirement.
Welcome to Health and Retirement, golden advice for your golden years. My name is Trey, Basa, your host this week, and I am a senior healthcare advisor joined by my associate, Mark Benefiel. Mark, welcome in.
Hey, Trey, what's going on?
Happy to have you, man. Today, we're going to talk a little bit about just kind of the basics of Medicare. There's a lot of information with the ins and outs, if you will, and not a lot of people are very savvy with all of these numbers and letters.
That's true. You name it. We run the gambit of questions. It's kind of hard to almost pin down what some of the most popular questions are, but I swear sometimes it's even the basic of what is Medicare all about? What's the difference between original Medicare and Medicare Advantage is probably the number one question that we get, besides eligibility questions, which is what's the difference between the two types of programs and why are there two types of programs?
Oh, totally. They're every single time clients will come in and they're just wanting to know what are the basics, and they'll even ask us at the end of meetings, what should I pick? What's the best route for me?
Well, it's hard to say what the best route is for somebody. As you know, really the best route has a lot to do with somebody's income situation, their health situation, their employment situation. There's lots of different variables that go out there. But, when you really boil it down, what a lot of people really want to know is what is original Medicare all about? Why is there original Medicare, Medicare Advantage, ultimately, which is the best for me? And usually what we find is after a thorough explanation of the two types, or the two different paths, people kind of come to a conclusion of what is the best one for them.
Absolutely. And it's always going to come down to the individual and what they feel like is the best fit for them and their lifestyle. So let's go into a breakdown of original Medicare, the two parts everybody needs to have before they hop onto any other part of Medicare. And we call that original Medicare.
Right. Original Medicare, if you look at a total kind of benefit stream, I guess, really what most people, when they talk about original Medicare, consists of four parts. We have Part A, we have Part B, a required Part D, just already confusing, right? Part A, Part B, Part D, and then ultimately, an availability of an additional private Medicare supplement. And so when we talk about original Medicare, that's really what we're talking about. Part A, Part B, Part D, prescription drug coverage, and then optional supplement benefit. And we're going to dig into those today, I understand, right?
Yes, absolutely. So to kick off today's show, we're going to hit up the first segment of In the Know, keeping you in the know about some of the finer details of Medicare, like the alphabet soup we were talking about. So let's break down Part A. Part A is your what?
So, Part A, and it is kind of confusing for folks because most people, when they get insurance that they've had from their employer long before they get to 65, has a real bundled together kind of aspect to it. Your hospital insurance, you go see the doctor, you get prescriptions. Maybe you have one card, right? But the government, in their infinite wisdom, has decided to pull all that apart into a lot of different pieces. I don't know if it's to make it confusing on purpose or not, but it's really not after you dig into it. And when we're talking about Part A, what we're really talking about is referred to a couple of different things. Sometimes it's referred to as hospital insurance. We often refer to it as inpatient insurance. And typically, if you're going to be in the hospital overnight, you're admitted in the hospital, then that's going to be billed under Part A. But there's some things you need to know about Part A as far as costs are concerned. A lot of people understand that most people don't have to pay any premium for Part A. When I say most people, meaning the eligibility is you have to have worked for 40 quarters over your lifespan and paid into the tax programs at that time. And they don't have a premium. You can still get Part A if you don't have those 40 quarters, but there are some costs associated with that.
I think the cutoff is like 39 quarters, and then all of a sudden you have to pay for Part A. 40, it's $0. Yeah. 39, not enough.
Yeah, you might want to work for another quarter if you had to, right? To save some of that money. But one of the things I think it stresses out a lot of people about, and they don't realize it, because a lot of people come to our office thinking, there's no cost for Medicare. They just don't know what it is. And they find out pretty quickly that there's quite a bit of cost on original Medicare and Medicare Advantage as well. But on original Medicare, they have a $1,632 deductible. Even though there's no premium, they have a per occurrence $1,632 deductible. And when I say per occurrence, basically that means that you could get more than one deductible a year. Right, which is different. Most people are used to, having one yearly deductible.
Yeah, an annual deductible, but this Part A works a little bit differently. Like
Absolutely.
you said, per occurrence.
Correct. So what I mean by per occurrence is basically, let's just say you were unfortunate enough to have an accident, car accident, and you end up in the hospital for a few days. That's $632 minimum deductible. 6 months later, maybe you had a heart episode, found yourself in the hospital again. Separate episode, separate deductible occurrence.
It can add up just like that.
Absolutely.
When we're considering some of these numbers that original Medicare gives you, the coverage you get with just original Medicare, it makes sense to get something added onto it. So, and we're going to talk about those two routes a little bit later in the show, but Part A, the Part A 1632 deductible is the big one.
And what really throws people off is what they're not aware of in most cases is that there's also an 80-20 co-insurance. So no premium, $1,630 deductible, but I have an 80-20 co-insurance. So after that $1,600 deductible, I'm still responsible for 20% of my care. Which most people are like, well, that's pretty normal. That's pretty typical of insurance plans. I'm used to that, right? Most of the plans most people have, if they have one, have a maximum out-of-pocket expenditure. And unfortunately, on Medicare, Part A and Part B, there's no maximum out-of-pocket.
No, they cover everything to the letter that they have defined with Parts A and Part B. Now, that 80-20 copay that Mark is talking about, that's going to be for quite literally everything else outside of the hospital. You have that deductible every time you go to the hospital, but then you have those reoccurring physical therapies, those tests, those diagnostic imaging. Everything is going to be an 80-20 copay for your outpatient care. And that can add up.
Can happen a lot. Just imagine, like I said that scenario earlier, you're in a car accident and you're in the hospital for a week or 10 days at the tune of $200,000, which isn't hard to do in a hospital. I mean, your water bottle, your water cup over there costs like $15,000 in a hospital, right? Yeah. I love those commercials I see on TV. People have those Stanley cups and they're saying, that's nothing. You paid $45 for a Stanley cup, and they have this like one from when they had a baby, a little cup, and it cost them like $15,000 or something.
Yeah, with the hospital labeled right on it. Yeah,
exactly. It has that little stretchy hose in it that they drink out of.
Yeah, it's just one of those fads, the trends.
Exactly. So that does come as a big surprise to people that they pay 20%, and just think of 20% of that $200,000, you could be on hook for $40,000. Now I know some people have done well manage your money, but not everybody. Maybe they're on Social Security, doesn't have an extra $40,000 laying around, including me, right? So, there's definitely some things we need to consider when we think about, Medicare and what those ultimate costs might be.
Right. And when we're considering those costs, but just between original Medicare and then everything else that you can get on top of it, it really comes down to those numbers. Just looking at the deductible and that 80-20 split, you'll see why. Yeah. You need to come in and talk to an advisor and pick up something in addition to original Medicare.
Would it surprise you to find out that those aren't all the costs that are associated with original Medicare?
Yeah, we're
just talking about Part A. What about Part D and Part D, right? We haven't talked about that yet. I mean, Part B itself, the Part A we refer to as the hospital insurance, or inpatient insurance. Part B is what we would call doctor's insurance. We often call it outpatient. Yeah. So those things you mentioned earlier, like physical therapy and going to the clinic and seeing my physician, or getting the X-ray, whatever. If those things are done on an outpatient basis, right? There's costs associated with that. They have a deductible as well, a little bit more reasonable. I think for 2024, it's $240, which is a once a year annual deductible. So that reasonable.
A drop in the bucket.
Right. However, there is a premium associated with Part B, and most everybody is going to pay the Part B premium of $174.70 for 2024. I say most people. There you could have some income adjustments if you happen to be eligible for Medicaid as well. There could be some adjustments. You could also have an income adjustment if your income is above certain levels as well, like above 103,000 or above 206,000 if you're married filing jointly. So definitely it makes sense to get together with one of us, if you have questions about income, et cetera, because it definitely can impact your budgets going forward. So there's a lot of costs associated. We talked about $1,600 deductibles, $174 copay, or 80/20 copays, $174 premiums, and then we still have our prescription drug coverage as well.
Right. Probably the more flexible part of all of this, the prescription drug plan. Parts A and B are necessary. Parts D, a lot of people don't think that is necessary because they might be approaching Medicare eligibility, not be taking any prescriptions, and all of a sudden, 10 years down the line, they're paying out the wazoo for Part D when they actually need prescriptions.
I had a gentleman come in my office who was 80 years old and never had Part D.
Oh, no.
15 years of no Part D. Fortunately from him, he was a veteran and had been getting medications through the VA, which in some circumstances will count as credible care as far as his insurance and Part D is concerned. And so we were able to help him adjust that, and we were able to utilize that for him. So that doesn't happen with all cases, but it definitely could happen. It could happen.
And those are one of those things that you just have to talk to an advisor about, something that you have to search more into, because there's a lot of red tape with this. What is credible coverage? What isn't? Coming in, talking to an advisor, and having a greater conversation about you and your particular needs and situations will create a clearer understanding of where you're at, what you need, and how to prevent all of this unnecessary cost down the line. Now, we also have everything added to that. So parts A and B really lackluster in coverage. We recommend people pick up something in addition to that.
If you're going to go the original Medicare route, one of the ways to kind of mitigate that exposure, if you will. And the insurance is what it's all about, right? As an insurance advisor, my job is to identify risk and then bring forth opportunities to mitigate that risk. And one of the risks you have, obviously, on original Medicare is a large financial burden could possibly happen. You could have some catastrophic costs if you hit that, over that 20% could happen. Plus, you have premiums and deductibles. And so one of the things that we bring oftentimes is a supplement, right? And we look at different supplements, or what they call Medigap policies, that allow people to cover up those gaps in coverage, those $1,600 deductibles, those 80/20 co-insurances. And there's a whole host of different private solutions called Medigap solutions or Medicare supplements that we often help people out. So there's definitely ways to mitigate that. It does come with a little expense, but it makes a lot of sense to take a look at some of those supplemental policies.
I just wanted to briefly mention the other route that we often explore with clients is the Medicare Advantage plan. A lot of people have some bad taste in their mouth about the Advantage plan, but it's something to explore because it could save you some money in your retirement. It could mitigate a lot of those costs between Parts A and Part B. And I'm going to wrap up the first segment of In the Know with that note. If you guys want to stay in the know with all of the alphabet soup, all of these numbers and changes to Medicare every year, go ahead and give us a call at 316-252-8707. Or you can always email us at mail@marketmedicareadvisors.com. We also have a website. You can check out all of the advisors and some of background information and have a greater conversation with us at marketmedicareadvisors.com. And with that, that's going to lead us into our second segment of today, the client case study. And Mark, you posed a very interesting case before the show, and I really want to talk about Ron and Marion. Marion?
Yeah, Ron and Marion, they're an interesting couple. I actually met them at a educational seminar that we're doing in Missouri, in Lee Summit, Missouri, back in the fall. And as you know, we do seminars all over the Kansas City area, Wichita area, et cetera. But their particular situation was kind of unique. Ron had, he turned 65 and a couple years prior to that. And when he turned 65, he, of course, he was working for the employer. So he was going to work for a few more years. And so he elected to sign up for Medicare and get Part A, which a lot of people do when they turn 65. It's not required, but they do that. And he did that, and he thought he was good. And then a couple months later, he was talking to some of his friends, and they said, oh, no. You have to apply for Part B. And if you don't apply for Part B in a certain time frame, then you're going to hit with a penalty. right? So he went out on his friend's advice, friends who had no license, by the way, and went out and signed up for Part B. So for 2 years, after I met him, 2 years later, for 2 years, he had and one other piece of that. He also selected, when he signed up for Part B, a Medicare Advantage plan. So for 2 years, he had insurance through his employer that he was paying for, right? And he had insurance through Medicare that he was paying for Part B. And then he couldn't understand why he wasn't getting any benefits out of the different plans the way they were designed. And the reality is that for 2 years, he had been paying $160 or so, $170 a month 2 times, because his wife was also on his plan, and she also signed up for Part B at the same time, about 3 months after him. So I haven't done the math what that adds up to, but the reality was he was paying a whole lot of money for dual coverage that he didn't need, but he was doing it on advice of some of his friends.
And that's probably one of the more common things that we hear in our offices, that they hear this, that, and the other from friends and family. And by all means, their experiences are true to how they experience them. But they don't have the knowledge, the experience, the licensure, certification to talk about these different options and to talk about what any one person should do. I mean, like you said, we do a lot of classes and we do a lot of informing. We teach people about Medicare, but we don't really come up with a decision for any one individual. We give them all of the information and all of the options so they can make up their minds themselves about whether or not they need to leave workplace insurance, get on a supplement plan, pick an Advantage plan, et cetera, et cetera.
And it's a very common theme. And these friends and family are well-meaning. I mean, the person who told him he had to go sign up didn't do it, out of negativity or trying to give him a hard time, or in fact, he's trying to tell him to do the right thing. It's just that they don't always have, like you said, that training. And a large part of our business here is education, is letting people and informing them as the rules change. And you really owe it to yourself. If you're listening to this, if you don't find one of our advisors to meet with, you find a licensed, advisor to meet with and go over your Medicare stuff, because you could cost yourself a lot of money, time, and trouble if you don't.
Right. And all of that money is going to add up over the years. And when you're approaching retirement, every dollar counts. And when you're needlessly throwing away money on 2 plans, in retrospect, it's just going to hurt. Yeah.
And it was a really simple fix, actually. I mean, a matter of a form that we had to fill out. Well, I had him do 2 things. I had him, one, go to his employer, because I can't make the determination. Go to the employer, talk to HR, make sure that their plan that they have was in fact credible care, meaning that it rises to the level equal to or greater than what the government's going to offer. Right. So if that was the case, then we're able to fill out one form and actually stop Part B, which a lot of people don't realize that you can do.
Right. These are the things that people learn when they come into our offices. They have a greater conversation about their needs and their particular situation. And I think that's going to wrap up our second segment, client case study. If you have a particular situation that you want to talk about, go ahead and give us a call, 316-252-8707, or shoot us an email over at mail@marketmedicareadvisors.com. And we are going to reach into that inbox, and we're going to talk about a particular question we got from
what was the name? I think it was Ken.
Yeah, Ken emailed us.
That's right.
At mail@marketmedicareadvisors.com. Ken had a question that we're going to talk about a little bit here today. And if you have any questions, go ahead and send us an email, mail@marketmedicareadvisors.com. But let's talk about it.
Fairly common question too. Ken, who's from Andover. So if you're listening, Ken, hey, what's up, buddy? Feel free to stop by here at the office time and say hi. Is that his question is, if I am on a supplement and I choose to go to Medicare Advantage and I don't like it, can I switch back to original Medicare? That was his question. To answer that, basically when somebody turns 65, or if they have a qualifying disability that allows them to go on to Medicare, they have a period of 6 months from their birth month to select a supplement plan. Right? They have 6 months to sign a supplement plan and still get what we call a guaranteed issue for that. If someone decides to stay covered by their employer's plan. There's another set of dates there where once they're finished with that plan, they have 63 days to sign up. So there's a lot of different variables, but the reality is you have what they call a free look. And if you decide to go to a Medicare Advantage program from a supplement, you can do that. And anytime within that first year, you can actually switch back to the supplement if you find out, I don't like I don't like Medicare Advantage for whatever reason. I don't see that happen a lot, but it does happen. And it's really a fail-safe that's put in by the system, because there are some nefarious operators out there that will move people from a supplement to an Advantage plan, sometimes without their knowledge. And so they built that in the system to make sure those people don't get caught up.
Those time frames are really important, especially when you're starting Medicare for the first time. You're gonna have a very slight window to get into a supplement plan, no problem, and then that free look trial with the Medicare Advantage plan.
Yeah.
These time frames are important. They are very delicate, but you have to be aware of all of your options before you think about making that move to Medicare. And that's going to wrap up the show for today. Mark, hey, thank you so much for joining me. I love talking to you about Medicare. And guys, it comes easy to us. We are licensed professionals in the industry. We do this all the time for our clients. But if you have any questions about some of these numbers or some of these time frames that we talked about, go ahead and give us a call at 316-252-8707, or maybe shoot us an email over at mail@marketmedicareadvisors.com. Mark, again, thank you so much for joining me today. And thank you to our listeners for joining me in Health and Retirement, the golden advice for golden years. We'll see you next time. Have a good night.
Unless otherwise indicated, all client and prospect names mentioned on this show have been changed to protect the identities of the individuals discussed. The content provided is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers. This is not endorsed or affiliated with any U.S. government agency, the Social Security Administration, or associated with any federal Medicare program. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information on all of your options. All rights reserved.